Hello and welcome to Meningitis and Inflammation presentation. What is meningitis? Meningitis is inflammation of the meninges or protective tissues that surround the brain and spinal cord. Meningitis usually occurs during fall, winter, and spring and is usually secondary to a respiratory viral disease. The main causes of bacterial meningitis are due to Streptococcus pneumonia and Neisseria meningitis. The main causes of viral meningitis are due to enteroviruses, aboviruses, human immunodeficiency virus, and the herpes simplex virus. The bacteria enter the central nervous system through either the upper respiratory tract, bloodstream, or skull wounds. Increased cerebrospinal fluid and intracranial pressure results from the inflammatory response that is caused by the infection. Bacterial meningitis produces secretions that are spread throughout the brain by the CSF, which covers nerves and other structures. If these secretions reach the parenchyma, edema and ICP become a major issue. Individuals who are at a high risk for the disease include older adults, people that are debilitated, college students living in dorms, and those who live in institutions. Clinical manifestations include sudden high fever, stiff neck, severe headache with nausea or vomiting, confusion or difficulty concentrating, seizures, anorexia, skin rash or petechial with meningococcal meningitis, irritability, delirium, and coma. Other possible clinical manifestations include photophobia, nausea, vomiting, and/or sleepiness or difficulty walking. Early meningitis symptoms may mimic flu symptoms and may develop over hours or a few days. Signs and symptoms are similar with both bacterial and viral meningitis. If a patient has been taking antibiotics for another infection, meningitis symptoms may take longer to develop or may be less intense. Other signs to test for meningitis include a positive Brudzinski sign and/or Koenig sign. The diagnosis of bacterial meningitis is made by culture of the CSF sample. The opening pressure should be measured and the fluid sent for cell count, CSF glucose and protein measured, and a gram staining culture done. Protein levels in the CSF will be elevated. The CSF glucose concentration may be decreased, and the CSF may be purulent and turbid. In bacterial meningitis, the predominant white blood cell type is neutrophils. X-rays may reveal infected sinuses. In some cases, a CT scan may show increased ICP or hydrocephalus. With viral meningitis, the ExPERT-EV test is used for diagnosing. A sample of CSF is used to determine if enterovirus is present. An examination of the CSF is done, and a typical finding is lymphocytosis. Polymerase chain reaction is used to detect viral-specific meningitis, and ribonucleic acid is another method used for diagnosing. The initial diagnosis of meningitis is based on history as well as a physical examination. When suspected, collection of specimen cultures, antibiotic therapy, rest, and IV fluids are initiated. Collaboration with healthcare providers to manage typical symptoms associated with meningitis such as headache, fever, and nuchal rigidity or the inability to flex the neck is also considered. Typical antibiotics that are used for meningitis include ampicillin, penicillin, and cephalosporin. These antibiotics are administered IV. The diagnostic tests that are used for bacterial meningitis include obtaining a CBC, coagulation profile, electrolyte levels, glucose, and a platelet count. Potential nursing diagnoses include decreased intracranial adaptive capacity related to decreased cerebral perfusion or increased ICP, risk for ineffective cerebral tissue perfusion related to reduction of blood flow and cerebral edema, acute pain related to headache and muscle aches. Potential complications include increased intracranial pressure, which potentially results in an altered mental status. Increased intracranial pressure results in compression of many cranial nerves, including the optic, ocular motor, trochlear, and abducens nerves. Results of cranial nerve compressions include papilledema, blindness, facial paresis, tinnitus, vertigo, and deafness. Other complications include headache and Waterhouse-Friderichsen syndrome. Thank you for listening to Meningitis and Inflammation presentation.